I want to talk about. So I'm Alejandro Pino. I am Serena's wife, and Ramsey and Mahat's dad, and I am a orthopedic surgeon. We'll talk a little bit about what that is, but like most things in medicine, I am a subspecialist. So within orthopedic surgery, I focus primarily on foot and ankle conditions, but as an orthopedic surgeon, my practice is got a portion of it quite general, so we do a little bit of everything. And what I'm hoping to do is, number one, keep you off of my operating table, or if needed, get you on my operating table so that we can get you back out there doing all the things that Zarina had just mentioned a second ago. So the way to stay healthy, and again, I'm not going to rehash the stuff that Zarina already mentioned, is being active. Most orthopedic studies that have looked at degenerative conditions, and what I mean by that is tendinopathies, tendinitis, arthritis, things of that sort, have shown that patients that have those conditions tend to do better if they are active. And I appreciate that one may limit the other, but if we can stay active or through treatment, keep that active lifestyle that we want, then we would need less intervention, hopefully, or we wouldn't be as held back by these degenerative conditions that we have. So stay active, do your cardio, as Zarina mentioned. Weight training is very important. You know, part of what falls under my purview as a physician is also the consequences of osteoporosis. So Zarina talked a little bit about osteoporosis and how that is an important factor in someone's time spent in life in doing the things that they do. But unfortunately, if someone has osteoporosis and they fall, that's where we start having hip fractures and spine fractures and knee fractures, and that's devastating. I'm sure we all know someone who has had a hip fracture before as they age and what that ultimately means. So by staying healthy, listening to your doctor, taking the recommendation as to healthy lifestyle and diet and medications when necessary to keep your bone health where it needs to be, you stay away from me. You don't want to see me, right? You definitely don't want to see me in the emergency room after a fall. That's not a great place to be. So keep doing the things that you need to do. But if at any point you start to feel limited for reasons that I'm sure we can all agree that are quite common. My back hurts right now. I'm sure we've all had back pain in the past, or knee pain, or foot and ankle pain. That's where you'd come to see me, or an orthopedic surgeon that you trust, and they talk about the different things that can be done. So before we end up talking about injections of different medications or surgical treatments for arthritis or tendinitis, you know, your orthopedic surgeon will talk a little bit about standard medications that can be taken to keep you comfortable, off-the-shelf medications or prescription strength, and then physical therapies. I'm guessing at some point we've come across that in our lives as something that has been offered for the treatment. And when your orthopedic surgeon or your primary care physician mentions that as a treatment, you know, a lot of patients, I see it on their face. And if someone comes in and they say my back hurts, or it's hurt for a long time, I haven't had anything done, what can be done? And we mention physical therapy, you see the look on their face. They're like, you know, come on. I mean, and with the doctor so that we can do some exercises. But it is when it comes to orthopedic surgery, treatments for most conditions are either physical therapies, anti-inflammatories, or surgery, right? So if you want to stay away from medications and surgeries, physical therapy, strengthening, stretching, staying active, moving goes a long way. And most patients, like I said, those 90% of patients that don't end up on the operating table have a successful outcome because of things like that. But then when that doesn't work, obviously we do have surgical options, and that's again, our subspecialty, and there's, depending on the condition we're talking about, different surgeries, and we can replace joints, or we can do various surgical procedures to repair tendons that are injured. And the point of all of this is so that you guys can go out and have quality of life, like Zuri earlier, and enjoy the time that you have and be active, relatively pain-free, understanding that we have some limitations as doctors as to what we can achieve. So, you know, again, not to rehash a lot of the stuff that Zarina mentioned earlier, I'm happy to answer any questions that you guys have about orthopedic surgery or medicine or any of these musculoskeletal conditions that we run across all the time. I know that sometimes it's a little bit difficult to talk to your doctor. Hopefully I can try to demystify some of these concerns that you guys have. So any questions at all that I can address while I'm here? Yes?
Can you and Zarina shed some light on the aging population with taking care of especially foot and ankle, because as the population ages with diabetes, those areas, especially ankle and foot, becomes more.
Yeah, and that's true. As we age, we have in orthopedic surgery, musculoskeletal conditions tend to be seen in young patients that are active and get hurt playing their sports, and then also older patients that have these degenerative conditions because of their joints and tendons starting to wear down. And it's a reality of life, and yes, diabetes is a factor that unfortunately has ramifications throughout the body. In my field of the subspecialty of foot and ankle, unfortunately, if someone doesn't take care of their diabetes, it can affect the way that you feel your foot. I'm sure we've heard of patients who maybe can't feel the bottom of their foot as much as they could otherwise because of this uncontrolled diabetes. And that's a big deal, because if you can't feel the bottom of the foot, you can't feel when you step on a nail. That sensation is protective. So if you step on a piece of glass or you have a little cut in the bottom of your foot, and that occurs under the setting of maybe uncontrolled diabetes, that can be challenging. Those cuts don't heal the way that they would for someone that doesn't have diabetes. They can become infected, they can become chronic, and then that has, unfortunately, pretty negative outcomes regardless of what we do when we get to that point. So for those of us who have diabetes, that's something that needs to be kept under control for a lot of the issues that Zarina would see in her office, but then more specifically in my world, to make sure that we can remain active and healthy with feet that serves us the way that they should. So control your diabetes and check your feet regularly and make sure that we're not having any breakdown of the skin, things of that sort. So yes, that is an unfortunate but common situation in diabetics, specifically as they age. Any other questions? Yes?
With the, try to be specific, the knee pain, when you, in my case, when you're awake, we're walking, especially when awake, you feel nothing, no problem. But when you sleep, there's that pain, and sometimes I have to cover my knees.
You're not alone. I shouldn't say most, but a lot of the musculoskeletal conditions that we see, specifically degenerative ones like arthritis or different types of tendonitis, they tend to present themselves primarily in the early phases, more so at night, and that really speaks towards the distractions that you have throughout the day and how that speaks towards your perception of pain. You're out and about, at work, doing the things that you're trying to do, and really distracted by that. But then at the end of the day, you have a disease joint. Let's speak in more specifics about a knee. As a knee wears down, that's a permanent condition that's never coming back, and that will only get worse with time. But it's a spectrum. It starts normal and then works itself towards a diseased knee that's at end stage, let's call it. And in those early stages at night, when you're not working, you're not distracted by friends or family, and you have nothing but yourself and your thoughts, that's when you start realizing the pain that's generated by the knee. And going back to the point that I just made, we can't cure arthritis, we can't cure degenerative conditions. So when it comes to this night pain, we're talking about staying active, physical therapy, and again, though it seems nebulous as to how it actually works in these degenerative conditions, it does, and physical therapy would address some of those night symptoms that you had. There's specific exercises that we would put in the prescription that you would take to your therapist that address some of these night symptoms. And then if that does not work, there's a combination of anti-inflammatories, from basic ones like ibuprofen, naproxen, and levomotrin, to maybe more possibly effective ones that would be prescription strength, and then injections of various medications that you had. There's specific exercises that we would put in the prescription that you would take to your therapist that address some of these night symptoms. And then if that does not work, there's a combination of anti-inflammatories, from basic ones like ibuprofen, naproxen, and levomotrin, to maybe more possibly effective ones that would be prescription strength, and then injections of various medications that would give us longer term relief of symptoms, so that you would get your injection and then for anywhere between 3 months to 12 months be able to sleep at night relatively pain-free as the effects of that medication continues to work. And then ultimately, again, speaking about specifics, there are surgeries that could be that last choice if none of these other first-line treatments work, either from simple knee arthroscopies, the 2 little poke holes where we go in and we do a little bit of cleaning of your knee, to full knee replacements, which also do fantastic, and patients tend to be very happy with the outcomes of that surgery. But that would be the stepwise approach that if you would be in my office that we'd go through, depending on how much it's bothering you. Get you to physical therapy, get you on some basic medications, talk about these more invasive treatments like injections or surgeries, and then see what fits your lifestyle best and your expectations.
It seems like it's triggered by cold. If you put a knee brace and cover it and it's warm, you don't get any. I don't get anything.
Yeah, and you're right. You're not. We see a lot of patients that have arthritis in various places, but generally it does seem to be quite common with knee arthritis that come in complaining of worsening of their symptoms, either with change in temperature, primarily when it gets colder, or changes in atmospheric pressure when it's raining or there's some seasonal changes. And we don't understand why that happens. And most arthroplasty specialists and general surgery surgeons will agree that we don't know why this happens. There's no scientific basis for that phenomenon, but it's nearly universal. But understanding that's when we prompt patients that maybe when the temperature is changing, or before you go to sleep, or when the weather is poor, you may want to reach for that bottle of ibuprofen or talk to your surgeon about these longer term treatment options. But yes, there is no answer for why that happens. We know that it does, but the treatments are those: physical therapy, medications, injections, or keep it warm. Put a warm pack on it, right? Any other questions? Yes?
Advice is related to it, but I have a question about when you go to bed for the sleep, and then suddenly the feet start burning and tingling, and because of that, the whole night you cannot sleep. So what is the main cause of it, and what is the possible solution for that?
Yeah, that is difficult. There are a lot of reasons why you can have that burning and tingling at night. It goes back to the conversation or the point that we just spoke about earlier. One of the most common reasons for that is something called neuropathy, and this is just broadly speaking. And there's different reasons why someone can have neuropathic pain. The most common reason in the United States is diabetes. And
what if the person doesn't have diabetes?
That's right, and there are other.
It's an autoimmune response for you specifically.
Yeah,
what is the solution?
Yeah, so autoimmune can be a cause, idiopathic, which means it just happens because it happens. But that also doesn't mean, in your specifics, it may not be neuropathy. There are other reasons for burning and tingling in the bottom part of the foot. There are other more local reasons to have those symptoms. You can have
plantar fasciitis would be one of them, or no?
Plantar fasciitis is more felt when someone's up and standing,
Okay.
and it's typically not burning and tingling. That does seem to be nerve related, but there are different pathologies or problems with nerves that can cause those symptoms. It can be from anywhere from your lumbar spine to nerves in the foot to these more generalized problems like the peripheral neuropathy or generalized neuropathy.
What are the tests you refer to do to find out the real reason?
Yeah, so first step, getting a simple x-ray. Depending on what your symptoms are specifically and what your exam shows the orthopedic surgeon that's treating you, based off what we would have as a discussion, and once we lay hands on the area of concern, we can hone in to whether this seems to be coming from the spine or whether it's more of an intrinsic problem with the foot and ankle. There's certain patterns that would tell us